Empower Pharmacy, joining us now to talk about these compound medications, what it is, and how you can get them as well. So, Jean, thank you, first of all, for being here. And it is Women's Health Month, so I know it's important. And Men's Health Month is next month. So let's talk about what these compound medications are and give us some examples of what you mean by this.
Yeah, so compounded medications are medications that are made for you. They're personalized and they are prescription medications. So your doctor and you work together and you come up with something that is custom made to your needs. And so a few examples of that would be in Women's Health Month. My favorite example to talk about is testosterone. And you might be thinking, women, testosterone? Why are we talking about that? But really, there is no FDA approved version of testosterone for women on the market. And so when women are needing a little extra help with either cognition, bone health, or maybe in the bedroom, testosterone is an excellent option. And we can compound that for you based on your custom needs. Once you and your doctor decide, we can find a formulation that's a baby dose of testosterone, and it can really help.
And I'm glad you brought that up because I know a lot of people are really having a bigger interest in this testosterone compounds, especially with GLP-1s out there and trying to balance your estrogen and your testosterone levels at the same time. It becomes very, very important. So I know you also have other examples out there as well. So can you explain in other examples where people may be using these compound medications?
Oh, exactly. I mean, the sky is really the limit here. Any medication that your doctor says, you might need this, or if you have an allergy to a commercial medication, this is an excellent opportunity to look into compounding. And you mentioned GLP-1s, and I'm going to bring that up too, because that can really help women, especially as they're going through perimenopause, menopause. We're seeing more and more evidence that when you combine GLP-1 therapy with hormone replacement therapy, your metabolic health, so the way you feel, the way your body processes energy, it just keeps getting better. And that has profound benefit for your heart, for your head, for your family that's depending on you. It's really impressive. So we are willing to work with your providers. We're willing to talk to patients to help them understand what is compounding pharmacy and how can it help me.
I'm glad you brought that up too, not just with the GLP-1s, but also with all of these compounds because, and I mean, I can use an example for myself. I'm about to give personal information, but I had a little incident. I had an allergy to something. So I went to my dermatologist and she prescribed one of these compounds where you go to the pharmacy and she combined a medication with a lotion to make it easier, but you can't get it over the counter. It's something you have to specially have done. So that's kind of like what you're talking about, right?
Oh, exactly. And yes, dermatologists love compounding because we can really customize if you're having a skin reaction, or maybe you're trying to avoid certain ingredients or certain fillers. And so, customized medication for you, the individual, is really thinking outside of the box. Whereas commercial medication, so the stuff that is normally available through a prescription, is really for the masses. And what we're offering here is an opportunity to make something that you and your doctor want to try just for you.
So let me ask you this question. If a patient goes in, talks to the doctor prescribes something that a lot of people use for a particular, whatever they've decided that person has, can a patient take it upon themselves and ask their doctor, well, are there any compounds that you suggest I use? And can they go that route by just being proactive themselves?
Oh, exactly. Yes, they can definitely have that conversation. And I encourage them to have that conversation. We list a lot of our most popular compounds on our website. And so if providers are interested, they can go and see what we have available just to get them thinking about what are some examples of customized products. And patients can also see this information and they can lead to that conversation where they and the doctor are finding out what would work best for me.
Well, Jean, I want to thank you so much for just opening up the eyes of so many people who didn't even realize they had options. Most people just go and, oh, I got to pick up something from the pharmacy or over the counter, thinking that that's all I can use. But knowing that there's compounds available and pharmacies like Empower Pharmacy kind of open up the advantages for more people to use more medication specifically for them. So, Jean Cunningham, thank you so much. Senior Director of Medical Affairs at Empower Pharmacy. We really appreciate your time and thank you.
Thank you. Have a wonderful day.
You do the same. Thank you so much.